Okay, hi Mary, this is Kylie again, and I'm now going to perform my last skill, which is rectal suppository and the rectal enema. So, if I had an order to give a suppository, I would make sure to check the suppository with the medication record and the physician orders to make sure that I have the right one. I then would gather my supplies and go into the patient's room. I would verify and look at the patient's wristband, and I would ask the patient to please state his name and date of birth to me. I then would perform hand hygiene. And I would position my patient in the left Sims position. Before I was to give him the rectal suppository. I then would put on my gloves. I would open up the lubricant, and I would place a small amount on the paper towel. I then would open up my suppository. I would be sure not to touch the tip. I would dip that into the lubricant. With the hand that I'm not touching the suppository with, I would pull up the gluteal muscle, ask the patient to take a deep breath in, and insert the suppository as far into the rectum as I can. I then would remove my finger and I would squeeze, hold tightly the muscles together so the patient would not try to expel the suppository. I then would tell the patient that they need to try and hold the suppository in for at least 20 minutes. I then would discard of my gloves and the rest of my supplies, and I would exit the room. I would check back on the patient within those 20 minutes. I would then, like I said, leave the room and I would chart when I gave the suppository and also the outcomes of the suppository. So I now will show you how to do the rectal enema. So just like before, I would come into the room and I would note that I have the right patient. I would look at the armband. I would ask the patient's name, date of birth, and then would tell him, explain what I'm doing. I'm going to be giving you a rectal enema. I would perform hand hygiene. I then would get my supplies ready. I would lie the patient in the left Sims position again. For the skill, I'm going to be lying him this way so you have a better view of what I'm doing. I'm also just positioning this bottle here so there is a place for my fluids to run into. So I would make sure to have all my supplies, which would be my gloves. I would position this chuck underneath the patient just to catch any liquid that would run out. And then I would also have my cleansing enema set. So I would do my hand hygiene. I would put my gloves on. My gloves on. I then would open up my enema set, which would be sterile before I opened it. I would be sure not to touch the tip. I would straighten out this tubing. I would move this clamp here to the off position. I would then open up my bag. So I would have my bag open like this. That is when I would pour my solution into the bag. However much was ordered, that is what I would pour in. I would then fasten my bag closed. I would then remove the blue cap. I would not have to dip this or rub any lubricant on the end because it is already pre-lubricated. I then would enter this just as I would enter the suppository. I would ask the patient to take a deep breath. I would pull up the gluteal muscle and enter it in. I then would hold that in place as I moved the clamp to the on position. I then would hold the bag up so all the fluid would run in. When the fluid was done running in,